friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro Clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in El Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Welcome back to Therapy Thursdays on Louisiana Living. I'm Angela Yarborough and this is Dr. Jerry Yarborough. And today we are going to talk about hip pain. How many of you have experienced hip pain? So I know it's a lot out there because statistics say that 450,000 hip replacements are done per year. So what can you tell us? How can we help that?
First, before we get into how physical therapy can help, we're going to just give you a quick overview of the anatomy of the hip joint. As you can see here, we have the pelvis, and it has a cup in it called the acetabulum. And then the head of the femur will sit in that acetabulum and is covered by a capsule, many muscles and ligaments to help hold it in place. So causes of hip pain can be multifactorial as always, but the most common cause of hip pain would be degeneration with primary osteoarthritis. You remember that's the wear and tear arthritis of our joints. Primary osteoarthritis is the number one cause of hip pain. It could also be from trauma if you're in an accident or what have you. It could be from conditions such as avascular necrosis. Younger people that have problems with their hips, most often it is avascular necrosis, which is a blood supply impairment to the joint. It causes it to degenerate due to lack of blood supply. It could also be from muscle strain, muscle tightness, or muscle weakness. All of those things can cause you hip pain. And if you've ever had hip pain, it can be extremely debilitating. So in physical therapy, we can do many things to help people with hip pain. After being diagnosed, either by their primary care providers, orthopedic doctors, or even their physical therapist, we will set up a program specifically to help what the cause is. So if it's strengthening, we're going to do exercises for strengthening. If it's because of tightness, we're going to work on flexibility stretches. We may do some manual techniques like a hip mobilization or soft tissue mobilization. And then we also have modalities or machines that we use to help relax the tissue, and it helps decrease the inflammation and helps decrease the amount of pain that your brain is sensing from that joint. So physical therapy can be very helpful with hip pain. All right, so come back in the next segment, and I'm, as always, going to give you some things that you can start doing today to help decrease hip pain. All right, thank you. We'll see you in the next segment. Welcome back to Therapy Thursdays. I'm Dr. Jerry Yarbrough, physical therapist and owner of Physical Therapy and Balance Centers. Today we're talking about hip pain, and in this segment we're going to show you 3 exercises you can start doing today to help you if you have hip pain. As our special guest today, we have my son Nicholas Yarbrough, and he's going to demonstrate how to do those 3 exercises for you, okay? So first I want you to cross your foot over your opposite knee like that. This is called the Piriformis Stretch. And we do it in 2 different directions because of the way the muscle lies. First, you're going to push away from you. You're going to feel more of a stretch in the anterior part of your hip. You're going to hold that for 30 seconds and do it 3 times. Research shows that that is the best way to do stretching. 30 seconds for 3 times. You do not ever want to cause pain with stretches. If you're causing pain, you're causing trauma, so please stay away from pain. Next, you're going to pull that knee up toward the opposite shoulder, and you should feel the stretch right in here, okay? Again, 30 seconds, 3 times. All right, the next we're going to move to a hamstring stretch. You can use a strap like this, straighten that leg out, put the strap on the bottom of your foot. We actually sell these stretching straps at all of our locations, and you're going to keep your leg straight and you're going to pull it up, straighten the opposite leg out, stabilize your pelvis. You're going to pull up only until you feel a gentle stretch. Remember, no pain. We do not work on the no pain, no gain philosophy here at Fyzical. Gentle stretch, hold it 30 seconds, 3 times on each leg. All right, and then those are stretching exercises. Now we're going to show you one strengthening exercise. You're going to lay on your side. You're going to bend your lower leg for support. Keep the top leg nice and straight, in line with your body. Otherwise, you're going to be using different muscles. I want you to keep that leg straight, in line with your body, and raise that leg up, just that high there, and back down, okay? As that becomes easy, you can get ankle weights and such to add a little more resistance, okay? You're going to start off doing 3 sets of 10, and then you can build up from there. All right, well, those are 3 exercises you can start doing today to help you recover from hip pain. If that doesn't do it, just pick up the phone and make a call to get you a physical therapy evaluation. Remember, in Louisiana and Arkansas, you do have direct access. That means that you do not have to have a referral to receive physical therapy. And yes, almost every single insurance company covers physical therapy. So give us a call. Let us help you love your life, and we'll see you next week, which we talk about another impairment that may be affecting your quality of life.